Hello. So for this week's video response, I chose to watch the TED Talk, What If Our Healthcare System Kept Us Healthy? So to answer the first question, how did the TED Talk challenge you socially, culturally, emotionally, or academically? I would have to say that this TED Talk definitely challenged me emotionally. It's kind of hard to not be challenged emotionally when, we're talking about people who are choosing to pay for their HIV medication over rent, for children coming in with asthma, and, they're prescribed an inhaler or something like that, but then at home they're covered in cockroaches, like she talked about at the beginning of the TED Talk. It's kind of hard to not think that, wow, our healthcare system is really failing people who don't have all the social determinants of health, but doctors don't see that as something that they need. Doctors, it's kind of, she mentioned it's like a don't ask, don't tell kind of situation where you can, if a child comes in with an ear infection, you can tell they're malnourished or other things, but, you don't really talk about it because as a doctor, there's not really much they can do. And that's where she started the program of Health Leads. And when she was talking about that, I would say that challenged me socially, or I guess culturally as well, for like, why haven't we had this before? Why haven't we had, if doctors can talk about these things with patients, they can write them a prescription for better access to food. They can write them a prescription for food, for heat, for, things like that. It just kind of blew my mind how simple of an idea it is, but how much it makes sense. So do the topics discussed raise concerns or catch your attention? Kind of playing off of what I just said, it kind of concerns me that something like this hasn't really been thought of before. And she did mention someone who got in touch with her. I forgot his name, but he reached out to her after she started this program. And he was like, I did this back in the day. And the government who was funding me, when they noticed I was writing out prescriptions for healthy food and that they were billing the medical center, they got mad at me and they were like, you need to only use these for medical reasons. And he was like, well, last time I checked, the cure for malnutrition was food. And so it's something that, and that was a long time ago. So the fact that this is still going on today, it's still such a big issue. And it's just simple programs where if you can write a prescription for penicillin, for an inhaler, for albuterol, for steroids, for anything, why can't you write a prescription for better access to food, for easier transportation? It's so simple, and I know a lot more goes into it than just you just writing on a piece of paper. There's more that goes into it, but that's why I think Health Leads is such a cool program, and I had never heard of it before. And, I think that it caught my attention also as a college student. There is a huge potential of untapped college students who really could benefit from something like this. I know as a public health major, I could definitely benefit from working in this kind of program. It sounds amazingly like something I would be very interested in. And so that really caught my attention. Did the TED Talk conflict with any beliefs you had previously, and what evidence did it provide you to change your thought processes of the topics covered in the TED Talk? It didn't conflict with any of my beliefs. It more just highlighted some things that I already knew about. I knew about the social determinants of health. I know how important they are and how, little they are, what's the word I'm thinking of? How little they are covered in a healthcare setting. So it more just kind of highlighted what I already knew, but it also opened my mind to programs that could help these people that are relatively simple in terms of thinking about them. So that's something that made me think of that. And then, did this TED Talk leave you with any questions? I guess my question would be where is this program now? And are there any in Michigan? Because I haven't heard of this program. So I know she was kind of talking more Boston area, but I think that Michigan, especially the Detroit area, could benefit greatly from a program like this, even here in Saginaw or Flint, where there's minority populations who are, of lower income. I think that that's something that could help people greatly here. It's something that I know a lot of college students in Michigan would probably want to be a part of. And she kind of made the comparison to well, if you can put so much money and effort into sports teams and expect so much out of them and, all that, why aren't we doing that for other students? Why aren't we doing that as for potential for other students? Because if I was told that I was going to get this education, get this experience, but I had to put in the hours, I had to put in the work, it'd be something that I would definitely want to do. It would be something that I would have a drive to do. It would make me feel like I have purpose, and it would help me apply what I am learning in school to a practical setting. So I guess my question is any of this in Michigan, or has it gone further than just the area that she is in and that she talked about? And then how does the issue or idea addressed in the TED Talk mesh with your past experiences or readings in this or other courses? So a lot of my classes have been about the social determinants of health. We've talked about it. It's a very important thing. It's kind of as public health what we look at when we are assessing health. And so when I was listening to this, all I could think of was like social determinants of health. When she was like, she mentioned like a child living with 12 siblings in a 2-bedroom apartment, a mom having to take 2 or 3 buses just to reach the hospital or the care center. That kind of like got my mind thinking like, okay, transportation, housing, access to food, access to heat and electricity, access to clean water. All those things kind of were playing in my head, and I was like, how crazy would it be to just write a prescription for that? I know it's not that simple, but it kind of is that simple. If these are the things that are affecting health so greatly, I can speak to this myself personally. I have asthma. I was not born with asthma. I lived next to a chemical plant, and I developed asthma over the years went on. My little sister did too, but my parents don't have asthma. So, I think, and I lived in a decent area, so people who live even closer to these kind of places or next to highways with noise pollution, all these kind of things can play a part into a person being healthy or not. And so I think it's super important that you address the health of a patient physically, but also, the social determinants of health, like we talk about in class. What was it that she also mentioned that was really, the waiting rooms. So she also mentioned, like, personally, I sit in a waiting room for 30 minutes and it seems like I see the doctor for 5 minutes. And so what if in the waiting rooms, people were doing things, they were talking to people to connect them to resources to, help them get heating or gas or easier access to water, stuff like that. And I think that's a huge untapped potential as well, because if you're just sitting there waiting, you could be doing something way more valuable with that time while you're at a healthcare provider. No one likes to just sit there. And I think that that's something huge that we should discuss in a class, like, just meeting people where they're at, which is a lot of what we've talked about, instead of making them come to you, meeting them where they're at. They're at the waiting room. Talk to them, give them access to resources. And so overall, I really found this TED Talk very inspiring, very eye-opening, and I hope to watch more like it.